7:01, and I think we can go ahead and get started. So hi everyone, thank you so much for being here. My name is Margaret.
I'm McKenna.
And we are so excited for you to hear from our speaker tonight, who is Dr. Ibrahim. She's a doctor of dental surgery.
Yeah, so I'll just give everyone a rundown of how the call will work. So Dr. Ibrahim is going to share a PowerPoint with us and talk about it for a little bit, and then we're going to leave the last 20 minutes or so for Q&A. And we're also going to record the session, so if you don't want to be seen on the recording, just make sure to turn your camera off. But Dr. Ibrahim, you can go ahead and get started. Thank you so much for being here.
Okay, well, thank you for having me. It's been a long day, and Margaret's going to help me with the PowerPoint. Very basic presentation. I'm going to put some visuals in there because I'm sure everybody's kind of tired being in college. A little bit tired of classwork and online learning. So I just want you to sit back, kick back, enjoy, relax. I don't know how many people are interested in dentistry. But if you are, I hope this will help you. If not, I hope you will enjoy this anyway. This is a presentation I gave to the Pre-Dent Pre-Health Club, Pre-Dent Pre-Med Club at NCSU several years back. So it might be a little bit outdated, and I don't want to speak down to anybody. You are a very bright group of young people, but I'm going to go through what I gave in the past, and I will elaborate where I need to about how things are today. A little bit about me. I graduated from NC State in, I have to think about it, 1981 in zoology, and I wasn't sure what I wanted to do. I knew I wanted to do something in the healthcare field. And so what I did is I became a medical technologist for 1 year, and in medical microbiology. And this is at the New Rex Hospital. Back then it was the New Rex Hospital, and it had the latest state-of-the-art lab. I was only 21, and I really burned out after 1 year. Did not know how people worked every day. And I figured, school, I need to go back to school. Was not sure what I wanted to do, but I applied to different programs, and I applied to the UNC School of Public Health. Back then it was called. It is now the Gillings School of Public Health. Excellent school. And I got the MPH, Master of Public Health. And during that time, I met several, not several, but one or two people that were in the School of Dentistry. And in the School of Public Health, we had to take certain core courses, and one of them was epidemiology. Another one would have been environmental sciences. Another one was virology, just certain health policy and administration. And that's another thing. There's a part there that I'll talk about as far as graduate degrees, if you decide to go that route. Excellent degree, and they were paying me, so I thought, why not? I'm going to live those 2 years anyway. I might as well get paid. And then it was a segue into being interested in dentistry, because I wanted to do my thesis on the effects of dental X-rays. And back then we didn't have digital. We had the regular dental X-rays that they took. But anyway, that led me into my interest into dentistry, and so I went to dentistry, and it's really the best decision, and the happiest and most enriching years of my life educationally was in the dental school. And I did go to UNC Dental School, but I suppose it's for most, just about every dental school. They're all good. So anyway, I have my own private practice, and I am an adjunct at UNC School of Dentistry. I'm not doing it this semester because of COVID, and that's something else I'll talk about as we get into the presentation, because there are a lot of changes that have taken place, whether indefinitely or for the time being because of COVID. But anyway, and I also I have my own private practice, and I set up a dental clinic with Miriam Clinic, and it was for health. It was just a clinic without the dental component, and I helped to set that up. And then I have my own 501c3 now, and it's called HAFA Clinic. And that is in my own that I set up at my office. I've also been instrumental and volunteered at Wake Smiles, um, and I'll have a list of where you could participate if you're interested. But anyway, let's get into the dentistry part of it. There are several opportunities in dentistry at the doctorate, the dentist level, educational, which is teaching, and that is very rewarding. Anything teaching is rewarding, whether it's in dentistry or anything else, because you're changing people's lives for the better. Hopefully, you're working with young people or older people, but you're helping to enrich them in ways that will carry them through. And I thoroughly enjoy teaching. I'm an adjunct at the UNC School of Dentistry, and I'm not right now because of COVID, and there's some different changes, but hopefully I will go back in January January. But love working with young people. I love working in the clinics, and I believe they benefit a lot because I practice uh, in my own. I've been practicing more than 30 years, so they are so eager to learn from somebody who's out in the field, so to speak. And then there's research, which is also very rewarding. If you want to go on to higher and higher education and do research, UNC definitely is one of the best places in the country to do research, to write grants. There's a lot of opportunities, beautiful facilities in the Corey Health Sciences building at UNC, and I'm sure other places in the country. Um, Clinical practice, as a practitioner, there are different specialties within dentistry, and I've listed them here. Orthodontist, or orthodontics, and that is the alignment of teeth and braces. I'm sure most of you are experienced with going to the orthodontist yourself, and it's a meaningful field. The only thing I want to say is during times of economic depression, for example, like in 2008, whenever we have a fall in the economy, the first thing that goes is orthodontics. And because it's a little bit less urgent than regular dental care. It's very important, but that's the first thing that people will tend to hold back on. Other than that, it is a fantastic field to be in. It's we don't want to say easier, but we envy our orthodontist colleagues because they have a lot of staff working for them and doing for them, and they don't have to really get their hands in and uh, just it's not as physical, but they work still, but they don't drill and fill. They don't give anesthetic. It's a little happy. They deal with young people. It's just all around fun. But also, from my colleagues' standpoint, when we do volunteer work, uh, they're somewhat at a loss. They can't volunteer the same way that we can because they don't do dentistry. And if we go on mission trips, they don't know, they can't do as much as we can. They don't, they haven't done the extractions or the fillings or the surgeries. So it's a little hard for them to assist. And sometimes if they really want to volunteer, then they just assist us. So that's one negative, and that's only if you're into doing mission trips and volunteering. Other than that, it's very lucrative, and it's highly desirable field. Periodontist is study of gums, and I'm sure uh, there's a lot of surgery in perio. They place a lot of implants, they do extractions, and there's just a lot of surgery involved. Uh, a lot of There's a lot of liability in being a general dentist and trying to treat perio patients. A lot of times they don't get better. You can maintain them, and uh, the patient compliance is not as desirable, or the outcome is not as desirable. So it's best a lot of times to refer perio patients and let a periodontist follow them through. And we do it just from the liability standpoint. However, we're able to do perio. Oral and maxillofacial surgery, fantastic field. One of the best is at UNC. And, that's surgery from, it encompasses all types: surgery in alignment of the jaws, surgery of taking out third molars, surgery in terms of biopsying and helping with diagnosis and surgical removal and repair of tumors, jaws, you name it. Um, and it's a fantastic field. That's something I would have loved to have done, but I could still do it as a general dentist. Pediatric dentistry is, of course, dealing with children. And a lot of times, I remember being in dental school, and most of us would think, I'm not going to do pediatrics because you can't control the child and this, that, and the other. But honestly, it's a wonderful field as well. You just, it involves the parent, it involves a lot of uh, uh, just behavioral and just controlling the patient, whether it's sedation. A lot of it involves hospital dentistry, but it's a good field as well. Endodontics is root canals. Um, Very lucrative field, but very, very tedious. And we call it cleaning up our house with the attic and the basement. I mean, it is, you work under a microscope, and just the best to those endodontists. They are wonderful, but they earn every bit of it. It is hard work. It's very tedious, it's meticulous. And when we come out of dental school, we try to do endo ourselves, but with time, we end up referring those. And then prosthodontist is the delivering harder cases of crown and bridge, prosthesis, dentures. We have difficult cases, and we refer them out to the prosthodontist. A lot of implants, implant placement. And then there's cosmetic dentistry, which is not really recognized by the ADA, but there are many uh, courses in Las Vegas that they give, and the dentist becomes certified, and then they become, you know, well known in cosmetic dentistry. And then there's general dentistry, and it encompasses all of the above. So if you're a general dentist, you could do all of the above. Nobody's going to, we're allowed to do everything. We're allowed to place implants. We're allowed to do surgeries. You just cannot advertise as a specialist within that field. But you could put the different procedures that you have to offer, but you can't advertise as a specialist in it. And honestly, it's the best field because you could do everything. You could do everything. There's no holding back. Just whatever you feel most comfortable with. We refer, if we don't feel comfortable. I refer a lot of my implant placements. I graduated when we did not have the implants like they have today. And even today, they don't have a lot of experience placing the implants when they come out of dental school. But I do restore the implants. So I put the crowns on top of the implants that are placed in by the oral surgeon, or the periodontist or the endodontist. Now the endodontists are doing them. Everybody does implants, actually, and general dentists do them as well. You just have to feel comfortable with the procedures. You have to do it enough times. And then there's the armed services dentist, of course, and that is a favorable field. Whether you're in the Army, the Navy, you're very well taken care of. You get good practice. Every time we have patients that have had work done by somebody in the Army or the Navy or the reserves, it's just excellent work. A lot of gold crown work, which we don't do a lot of because gold is expensive now. But they do good work, and you get good experience. If you're young and you want your somebody to pay for your dental education or help you with your debt or whatever, or to get started, that would be a wonderful field to go into. And they house you, they give you a stipend for housing off base, and you are just given, you just, it enables you to so much in terms of experience. And you come out top notch. And then there's public health dentistry, and I do that quite a bit, because I did get the MPH, but honestly, everybody will be a public health dentist if they volunteer and do some of the work that I have to mention a little bit into the presentation. And that's just serving a community of people, whether it's a community of women and children, or those who are at the poverty level, or those who do not have access. And then there's administrative, of course, and that is heading the clinics, setting them up, etc. Okay, next slide. Okay, so I have, in order to be successful in dentistry and successful as a dentist, you need years of practice and continuing education. And I tell that to my students all the time. Um, you're a different dentist when you are in your 30s. You practice differently when you're in your 40s. You practice differently when you're in your 50s and when you're in your 60s. I'm a lot different as a practicing dentist than I was back when I was 30 years old or 40 years old or in my 50s. I didn't really feel comfortable in doing what I was doing until I was well into in my early 50s. And I'm just being very honest. You become very proficient from doing what you do day in, day out, year in, year out. You could be very good at book learning, but the bottom line is you have to do the work. You have to practice. You cannot not do it. And a lot of times people can teach dentistry, but you need somebody who does dentistry on a day-to-day basis, year in, year out, to be able to teach clinically. So you really need years of practice. You need years of practice, and you also need the wisdom from the years. You can't get that just by being by being very good, by being very very capable, et cetera, et cetera. You need the years behind you. So that will come. You will grow old, whether you like it or not, but you will become wise, and you will gain that wisdom. And you need that in dentistry, because you will get patients where it's up to you to decide what to do. It's up to you to decide, do I do this or do I do that? You're constantly on the honor system. It's all on you. And you just have to be a functioning person with wisdom, who wants to put the patient's needs first. So character has a lot to do with that. And here I have that: put the patient needs first. Put the patient needs first all the time. Don't ever put your own needs. Put the patient's needs first, no matter what, and things will always fall into place. And then I have need to be patient and learn experience, learn from others. Dental school teaches the bare minimum when it comes to practice. And that is so true. I put that back from several years back, but you get the basics, you get the bare minimum in dental school. It's only when you're out there practicing. And nowadays in the dental school, they do have the match program like they have in medical schools, for residencies, for the GPRs. And that's what's really recommended. You definitely need to leave the dental school setting, the teaching setting, and learn to do dentistry hands-on. And it's hard to go straight into private practice. When we graduated, 90 something percent of us went into private practice, and just like 2% went into a residency. And close to 90 something of us set up our own practices. Today, it's almost 100%, go on to a GPR of some sort or another. I cannot fathom going straight from dental school and doing private dentistry in an office. I did that. It was not easy. And it wasn't my own. I worked in different offices. But anyway, and I say be involved and eager in organized dentistry, and that is so important. As far as private practice, you become isolated after a while. You're by yourself. You are the boss. You are it, and you have staff that's working and answering to you. There is an awful lot on you, and you learn a little bit of that in dental school, but not enough. And so being a part of, for example, the North Carolina chapter of the that's American Association of Women Dentists, or being active and volunteering for Wake Smiles, or Merriam Clinic, or the Raleigh-Wake County Dental Society, or the North Carolina Dental Society, or the North Carolina, the moms and the pops clinics that we have, it helps to bring you out of isolation. And you need that camaraderie. You need to be with your colleagues. You need to know that you're not in this by yourself. And that's the only, really the one, not the only, but that is one huge negative of being in private practice, is just the isolation. Now, if you're working with a colleague or in a group setting, that's fine. But a lot of times, even so, you just feel like you need your colleagues around you. And we do that. Before COVID, we would meet religiously for the Raleigh Wake County Dental Society. It's wonderful. We have a speaker while we eat and socialize. We get CE credit because we sit there and watch a presentation. um, I am I was the president of the North Carolina chapter of the American Association of Women Dentists. My colleague and I, she's an orthodontist, we did it for 9 years. We couldn't believe we'd done it for so long, but we were able to reach out to different practitioners and have them come speak to us. And we're also very instrumental in Wake Smiles. Um, that's uh, that's at the Salvation Army building on Capitol Boulevard. And I'll have everything in case you're interested. There's just so many opportunities for volunteering, um, many opportunities to be involved, so that you don't feel that isolation. It's very important that you be together. Private practice, there is a large practice and associateship versus small practice, pros and cons. Okay, so nowadays, private practice, it comes in many varieties. You have the solo practitioner like myself, a small office, a small practice group, and that's fine. But I feel isolated a lot, and I wish I had somebody with me sometimes. Associateships are hard. They 99% of the time they don't work for one reason or another. In my experience, from what I have seen, colleagues and friends, it works when you have, for example, a parent and their child. I'm saying child, but a parent and their dentist offspring, whether it's their son or their daughter. Those work, and it's because the parent is there for the son or the daughter unconditionally, and vice versa. And the daughter or the son listens to the parent because that's their parent. It's hard a little bit when it's not, when there is not that relationship, and so they're almost always temporary, until the person moves on. The large practices, we have a lot of corporate practices now, especially in the Raleigh area and Charlotte, and they're like chain practices, and they have become uh, I don't want to say they haven't come out, they're budding. They're like, for example, there's Rick Habini and there's Lane and Associates, and they have like 27, 28 different offices within the state. They're very large. And so my recommendation is for somebody who thinks that they may be interested in dentistry is go and shadow a small practice, shadow a medium group practice, shadow the corporate big larger practices, and then see what you like. Really, that's almost mandatory. Do that so that you could see what appeals to you. Um, let's see, the need to give back, donate, and volunteer. Yeah. Okay, the next slide. And here, volunteer opportunities in dentistry in Wake County, um, the locations for Wake Smiles and Merriam Dental Clinic. Okay, so I can provide that for everybody, whoever is interested. There's also the Colgate bus, and this is the person that I'm affiliated with. Whenever I'm able to, we used to do that at the fairgrounds. There's also Give Kids a Smile. Colleague of mine organizes that, as well as the School of Dentistry. Um, and it's a lot of times they have it down in downtown Raleigh, Marbles Museum, where they screen children. my colleague, Dr. Kavita Guy. She's very instrumental in that. We also have the Baptist Dental Bus, and that is a wonderful experience. I love the Baptist Dental Bus, and right now it's a little nostalgia because I volunteer every state fair, and they give me free tickets to park right up, and they give you whatever junk food you want to eat, et cetera, et cetera. But it's wonderful because you give back to a community, to a demographic of people that we never see in the U.S. It's heartbreaking, and I feel sad that we can't do it this year because there's no state fair because of COVID. And I could provide those for the folks who are interested. Do you have the next slide? Some final notes. Okay, like I said, each and every one of you should be able to get into dental school. It's just a matter of time, so be patient. The past several years, dental school has been extremely competitive, and I don't want to say I don't know why, but I think I could guess at several reasons why. But it's become extremely competitive. Um, uh, because first of all, for example, let me compare it to medicine. Uh, when you come out as a medical doctor, you have 3 or 4 years of internship and residency, but that's not it. But mostly when you do practice, it's you have less controls there. You're under the umbrella of the hospital, and there is hospital dentistry as well. I did not go into that, but you're dictated to by the hospitals. You're dictated to by the big pharmaceutical companies. You're dictated to by the insurance companies, and it's become really difficult for somebody coming out of medical school to just go out and practice. And it's hard. You have to be affiliated with a big group, usually attached to a hospital now. In dentistry, it's still not that way. It's coming to dentistry. We're not out of we're not immune. But in dentistry, the dentists in the state, and I think just all over, they tend to be a very strong conservative group, and we bind together like no other. Seriously, we have at the Raleigh-Wake County Dental Society, we have what's called legislative night, and that's when all the legislators who are running for the Senate, for whatever seat, they just come and they appeal to us because they know that we are a big group, and they could either get elected for because of us, or they could not win the office because of us. So we are a strong group in North Carolina. The dentistry, the profession of dentistry in North Carolina is very strong. We're a strong, cohesive group, and I think that we are envied by other professional groups. I don't tend to see this as much with the physicians. I do see it in dentistry. So if we want something, we are gathered together and we lobby, and we get what we want. I hate to say that, and it's a huge generalization, but not really. So there's a mass influx of applicants for dentistry. When I'm teaching, some of my students, they're no longer 22 years old or straight out of college. The average age now at UNC is 28, I believe. There were kids in their 30s. There were some who had PhDs. There were some who had their JD degree. They were real estate brokers. I mean, they just decided to chuck everything and go into dentistry. And I think because dentistry is lucrative, you could earn as much as you want to work. Let me put it that way. Um, so we're seeing a lot of that. So just be patient. Everybody will get into dental school. It's just a matter of time. It's like getting on a bus, and if there's not enough room, so the bus will go, and you just wait your turn. Don't be discouraged, and certainly don't just apply to the two schools in North Carolina. They're excellent schools. ECU is competitive simply because they only take 50 students. I was going to say 50 patients, only 50 students, and all of them have to be residents from North Carolina. That's the last of what I heard. UNC Chapel Hill takes 80, and I believe they are going to cut back on the number of students that they take because of COVID. But don't hold me onto that. That's just from some of the ideas that have been going so far. Just because of COVID, it has held us back. But go ahead and apply to I don't want to say as many schools as you can, but be practical, be reasonable, and go outside of North Carolina. There are wonderful programs and wonderful schools in other states. It's refreshing to have somebody come back from another school and practice in North Carolina, because we learn from them and vice versa. Um, some pointers and advice that might help you to get into dental school sooner. The obvious, which is grades. Okay, you have to have good grades. You don't have to have the high, 4.5, 5.0. I don't know. Things are so so inflated these days. But try to have good grades, but you don't have to be a robot. Obviously, the DAT scores. I believe at UNC, I mean, they have some kids doing 22, 23, 24, and then they have some kids who are doing 18 or 19. Um, try to do try to do 20 and above, and that's just coming from me. Uh, my advice is try to do old tests and take them, do as many questions as you can over and over and over again. And also your major of study, that should not have an impact, as long as you get your sciences, the required science courses. Go ahead and do whatever you want to do. And to be honest with you, the involvement is huge. I have involvement here. What you do as a person is a huge thing. If you have the good grades and if you have an adequate DAT score, but you have extraordinary involvement in something, that's huge. You know, separate yourself from the rest. For example, start a foundation, be passionate about something, have something that you do that makes you stand out from the rest. And of course, your attitude, that has everything to do with it. um, Put your horse blinds on. Don't worry about what other people are doing. That could really stress you out, it could freak you out. Don't let that happen to you. Put your horse blinds on, have a passion for it, and know that you're going to be successful. Just get in. All you have to do is get into a school that is accredited, in this country, in the US, um, and you'll be fine. It doesn't have to be from North Carolina. It could be at, any one of the schools in any one of the states. Okay, the next one. I'm showing some visuals so that you guys don't get tired. I took a group. Isn't there another slide, Margaret? Is there another slide?
Yes, there is. Do you see it on the left of my screen? The some final notes continued.
Oh, no, thank you for telling me. I'm glad I mentioned that. Is there something else I left out on the left side?
No, do you
Yeah.
not see the two slides on my screen?
I do. I see the one on the left. Okay, some final notes continued. That's the next one.
Yes.
Okay, the less obvious. There is apparently an essay on your interview, on your application, and that's important. Make sure you have. That's really important. Let me tell you. I went over an essay. I mentored 2 or 3 kids, and when you're young, sometimes you write things. Um, it makes a huge difference when you have an older person reading an essay from somebody who's in their early 20s. Okay, let me put it that way. I read their essays and I thought, this is a very, very uh, good student. They have potential, but the essay is really not that great. So I helped them to rewrite it, and it makes all the difference. So when you write the essay, try to get somebody who's old to read it. Okay, somebody who's, just imagine that take it to somebody who could be on the admissions committee. The interview can make you or break you. Okay, so practice the interview, but don't psych yourself up. Don't, I want to just tell you, be yourself, and be yourself, be down to earth, have something that you could speak about. They will A lot of times they try to throw you off and they'll ask you something offbeat. just be prepared. And for that, I would ask different students who've been through it, and see what type of questions you could be asked. There's a part of me, that says just be yourself and be at ease. And a lot of times the interviewer could sense that, and they become, they become at ease, and it becomes a very nice discussion that you have, and a nice visit. You have to have a connection to the school somehow at UNC. Okay, that's my experience. So if you are watching this, this little lecture that I'm giving right now, and you want to go to dental school, try to find a way to have a connection with the dental school. And right now it's a little difficult with COVID. Before, anybody could come and go to the building as they please, 3 or 4 buildings, different entrances, different exits. Now that's not the same. You can't just walk into the schools because of COVID, unfortunately. Because of obviously you need to be screened. They have to be careful, who's coming in, et cetera, to protect everybody because of the pandemic. So hopefully with time, things will ease, and somehow, some way, you folks are so smart. Be creative and find a way to connect to the dental school. Now, that could be with you being in touch with somebody who does research. You could be in, there's a program called Bridge to Gap. Have you heard of that? Am I saying it right? Or Gap to Bridge? It's Margaret's shrugging. My daughter told me about it. I think it's called Bridging the Gap or Bridge to Gap. I'm not sure. I'm sure one of you kids in the audience. I'm sorry, I don't mean to say kids. I'm respectful of all of you. I'm sorry because I just feel so much older. But somebody in the audience must know what I'm talking about. But there is a program. It's a mentoring program, and you could be mentored by a dental student, and you could go with them and shadow them in the dental clinics. And I saw that at firsthand, and it helps a lot, and it breaks the ice for you, so it's not such a mystery. See if you could connect with email a researcher. See if you could work in their research lab. Email, I just want to say somebody in a field that you're interested in, pathology, for example, and ask if you could establish rapport with them. Try to connect with somebody at the dental school. You need that. Okay. And then a lot of times, students who don't get in the first time, they're told to get a higher degree. And um, what I want to tell you is, if you're going to go for a higher degree, but you have your heart set on dental school, and I don't blame you, and you will get into dental school. It's just a matter of waiting for the right time when there is room for you on that dental bus, like I'm saying. Um, I highly recommend the MPH. I happened to stumble upon the MPH just because they offered me a stipend, they offered me an assistantship, they offered me something to do because I didn't know what really wanted to do. And I was young, and I thought, I'm going to go through these 2 years anyway. They're offering me a job, they're offering to pay me. And then at the end of it, I get a degree. Why not? Well, that MPH has opened just about every door for me. Um, Especially if it's at the Gillings, now it's called the Gillings Global School of Public Health. I mean, I got into every dental school I applied to, and 1 or 2 of them took me without the interview because of my connection with the UNC School of Public Health, and because of that MPH. And honestly, I feel like going back just for my own edification. They have wonderful, wonderful fields in that School of Public Health. There is maternal and child health, where you could treat a community of women and children who are at the lowest rung of the socioeconomic scale. How to provide the health care for them, the dental health care for them. You get to meet people from all parts of the world, because they have a lot of scholars and a lot of students from Africa, from Asia, It's so rewarding, but this is something that I'm so adamant about. I want to let you know, consider the Master of Public Health, especially if it's from UNC. They have a fair, School of Public Health fair, and you can go and meet everybody and see what there is offered. It is just a top-notch school. It's right there with Harvard. And like I said, if you get the MPH there, the doors are open to you. Okay. And like I said, put your horse blinds on. Don't worry about what other people are doing. Read online what you could do to prepare, but don't keep going online. I mean, don't do that. Be your own person. And then I want to talk about, if you're in dentistry for the money, dentistry is very lucrative. You can make a lot of money if you work a lot. If you put in the hours, but that is not everything. And from my experience, just remember this when you're older. Remember that you heard this from me. Some of the most miserable colleagues that I know that have the most dysfunction are those that have made the most money through dentistry. It becomes something that consumes them. I don't mean to be disrespectful, but it's just obvious you don't need that. If you do it for the money, you will never be satisfied. You will always be striving for more and more and more. And at the end of the day, uh, a solo practitioner in a small office will have just as much as somebody who owns a huge practice, honestly. You own a big practice, you own a huge practice, then you have so much liability on you, and you have so many demands, and you have people that you have to support. Can you imagine when the pandemic hit? Can you imagine how everybody felt who had their own practice, and including me as the small practice owner? We have practically had to start from scratch again. We had to start our practices up from scratch. It's unprecedented. We've never had to do something like that before. Um, I mean, it was hard. So what I want to say is, um, do it because you like it. If you do it for the passion, I'm not kidding, you will be so successful. You'll be successful financially, and you will be successful professionally. Put the patient's needs first. Don't fixate on how much you can make, and you will be very successful. I mean that wholeheartedly. And then, like I said, how you practice in your 30s versus your 40s versus your 50s, um, it's different. You will be a different person within each decade. That's how I see it. And unfortunately, your body starts to give out as you get older, but you become a very good practitioner as you get older. You become wiser. You are more giving. You have more wisdom. You have more experience. So maybe that's the time for people to teach. The next, you have another slide. Oh, let me go back to those pictures. I'm going to show some pictures now because it's a lot of talking. I want you guys to enjoy some visuals. The wonderful thing about dentistry is you can do mission trips, and you have that opportunity in dental school. Um, and they go to Uganda, they go to China, they go to India, during, let's see, um, during spring break, I'm sorry, I took NC State kids who are in the pre-med, pre-dent, and we went to Panama one year, and we went to Nicaragua another year. And these are some of the pictures. Let me see. I mean, you could see that. Go ahead and scroll. Let me talk about this. Okay, let's stop here. Um, every one of those kids have gotten into dental school. Okay, and this was back in no, not 19, I'm sorry, 2017, not that long ago, actually. Every one of them is in dental school. Only one of them is at UNC, okay? But one of them is at uh, University of Maryland, one of them is at Tufts, one of them is at University of Arizona, one of them is at University of Michigan, and that is a number 1 school. So I'm very proud of these kids. But look at the we practice. This is in Nicaragua, and I want you to look at that blue little partition that I put there, I, I was able to, my daughter and I, we gathered, if you could gather a certain number of students to go, then one of you can go for free. That's what it was. And so we were able to get maybe 14, 15 kids, and we organized a trip. One was to Panama, one was to Nicaragua. And we went into a church. It was a one-room church, and we had nothing to work with. So I have two students here holding the flashlights for me. One always held two cups, one with water and one to spit in. And then another one, you can go on, let's scroll some. Let's see, another one. This is, they taught, we taught them suturing. Go on up another one. The students had an opportunity. And this is, the program was called International Service Learning. And this was all us. And the wonderful thing about dentistry is if you have older kids, they will grow with you and they will work with you. You could employ them in your office until they go off on their own. This is a neat picture here. A flashlight here, a flashlight there. I think there's somebody with a bucket on the right side. I don't know if that shows in there. Let's see if there's another one. Let me, no, yeah, go on up a little bit. There's the bucket. This is what we had for the patient to spit in. But miraculously, we were able to do extractions. This is Nicaragua, very sweet kids. They were so poor. They had nothing but the shirt on their backs. And, this is what they had. He only had one shoe. So it really, it humbled you. Let's go back up. Let me see if I could comment a little bit on the other. This was in Panama, this picture here. And honestly, I learned so much from the practitioners overseas. They truly had a lot to teach me. She was a pedodontist, and I mean, no gloves. She's handing me the instrument. I'm outside. I've propped the child's head on my knee to do an extraction. But I learned a lot from her, and this was at a school in Panama as well. Um, Go back up again. Let me see if there was something. That was Nicaragua. Okay. Um, okay, that's it. Look, you can go back down. I mean, we were able, there was a lot of opportunity. Okay, here, with COVID, we had to be a little creative with PPE. PPE has been incredibly expensive. I mean, we spend money out the wazoo getting N95s, KN95 masks, getting surgical level 3. And this is Dr. Renata Saltman. She is an orthodontist, and she is also an avid quilter. So she was able to be creative, and we're all wearing caps now. And I just wanted to show those caps that they have on. This is me in my office now with COVID, and honestly, it looks like Star Wars. I feel like playing that song in the background. I am wearing two caps. This is at the beginning. We were scared to death to come back to work. I think we all stopped in March, and we came back in June. But I'm wearing two caps. I'm wearing 3 masks, level 3 masks, because the N95 tends to suffocate. I mean, I can't work with it. I covered up my neck, my loops, and a shield, and a whole gown. Go on. The next person is my assistant. We look like nuns covered up from top to bottom. But we still cover up, believe it or not. Go ahead, go on. And this is what we've had to do. We've had to tell, are there slides side by side? Oh, I'm sorry. Go back up. I'm not able, go back up. Yeah. Go back up. Let me see if I left anything out. Yeah, go back up. Okay, this is myself on the right side here with 2 of my staff in the office. And as you could see, being an older dentist, I can't let go of paper charts. We have everything electronic. Every patient has an electronic chart, but I always have to have a paper chart as well from me. Because I am so, what if something goes out and we lose all the information? I don't know. It's hard. We back everything up. but I still need my paper charts. Okay, go ahead go down a little bit. Yeah, over here, I mean, we have signs all over like this one for your own protection. We've closed the bathroom that's at first. Um, Over here on the left side, if you could read, can you read that? The patient, this is at the very beginning. The patient does call us. They stay in their car. We make sure they have a mask, and we only had one patient in at one time. This is at the very beginning. We've relaxed a little bit. Um, and then my same colleague, Dr. Renata Saltman, she's the avid quilter. These are some of the other caps that she's made. Okay, go up a little bit. No, go down. I'm sorry. Scroll down. Okay. So this is my contact information. If you need anything, I'm more than happy to help you. Um, and I hope I have given you some advice if you're interested in dentistry. If you're not interested in dentistry, I hope I've entertained you enough. So, any questions?
Yes, I think we do have a few questions in the chat, and we can go ahead and read them off to you. Our first question is, how can we shadow during the pandemic?
That's a good question. You're more than welcome to shadow with me. I think the private practice offices will allow you to shadow. I believe they will. I had a fourth year dental student come and shadow with me this past week. You just have to be decked out to the hilt in PPE. And what we do is anybody who comes in, including us, we take the temperature and we ask the same litany of questions. And you're just very careful. Honestly, in dentistry, there has not been a cluster of COVID within the dental community, within a dental practice, with anything dentistry. And that is, I think that's because we are just so in tune to infection control because of HIV from the 1980s. That was a huge deal back then. That's when we started to wear gloves. Before that, we were doing what's called wet dentistry. You didn't have to use gloves, but we are always so careful because of HIV. We're careful because of Hep C, hepatitis B, all of those things. The only thing about COVID now is we can't see it. With a needle stick, you see the needle stick, and you have protocols. With the COVID, it's aerosol, a lot of it. So we also have we have stripped everything. I don't think you have all of the pictures. I took a picture of my office. It is bare. I mean, there is there are no magazines, there's no toys for the kids, no pamphlets, no brochures. Everything is cleaned. We have filters, air purifiers. You just this is just how it is. We're very careful. We've always been careful. We've always been careful. This is nothing new to us. This is really nothing new to us. We've always, uh, worn PPE ever since the 80s. So right now, I wear 3 masks, um, and I feel okay. And we never take them off. We don't take a lunch hour. We work straight through. We may take a break. If somebody needs to take the mask off, sometimes they go outside, but we don't even have a need for that. And then we leave. So we leave about an hour early. But we're so used to infection control. We're so used to, OSHA. We have to take courses in OSHA on how to disinfect and how to sterilize and how to protect ourselves and how to protect the patient. This is nothing new to us. So as far as shadowing, I believe you're able to shadow, and I would reach out to the. I have so many connections with the dental school. If you're really interested, I can provide. I can get you connected. Um, I mean, there's a plethora of young kids. I have access to them. Let me say that. My daughter is in dental school, and she does a lot of what I do, I guess. So I could, and she told me, she was going to help me out with this presentation because I thought that I could get somebody who's in it, but she has an oral surgery exam tomorrow. So she said she was not able to, but she'd be more than happy to help you. And I could provide that for you. And I'm sure they will allow you to shadow. You're just going to need to go through clearance.
Thank you so much. Our next question is, does it matter in which state we practice?
It doesn't matter at all which state you practice. You just have to be certified, board certified in that state. We have the North, we have CETA, Southeast, the boards. We have the Northeast boards. When I graduated, there was no reciprocity. You took the North Carolina boards and they gave it only one time. Can you imagine? It was a crapshoot. And if you failed it, then you waited a whole year before you could take it again. So what the kids did is they crossed the state line and they took the Virginia boards, and Virginia was offering it 8 times a year. So they would live near Danville and every day they would practice in Virginia and come back to North Carolina. But it does not matter what state you practice in. You just have to make sure that the board you take will be within that state. And there's the Northeast Regional, Southeast Regional. I believe California has their own, but there's many boards you take that will allow you to be board certified in different states. So it does not matter at all. And before the boards are taken, you get what's called a provisional license to allow you to practice until you could take the board. But that has to be through the state's board. So yes, you can practice in different states. It's just needing to take their board.
Thank you so much. Our next question is, by any chance, do you know if the NC Mom Clinic has already opened registration?
Ugh. The moms and the pops clinics, and those are wonderful. I am not sure, and I can I can provide the information for you. I do have the numbers, and you could also go online. Things are so different with COVID right now. The dental school is having to adjust right now themselves. Um, I mean, God forbid they were thinking if there's a cluster and it sets them back, they may need to do it in 5 years. That's just something that's put out there. Um, Things are so different right now because of COVID. We're just waiting for that to be over with. My impression is probably they're starting up. Maybe they have it. If you want, I have colleagues who organize the moms and the pops clinics, and I could get back to you. So I've got my name and my email, and I could connect you.
Thank you so much. Our next question, and probably our last question because we don't have too much time left, is there anything you recommend high schoolers to do if they're interested in dentistry?
If high schoolers are interested in dentistry, just be in it. Um, Enjoy it and shadow. I did that when I was in high school, actually, with one office. And I did not like how I was treated, and I should have never done dentistry after that incident. But they're young. High schoolers are young. They need to enjoy life. They need to not be worried about being competitive. They need to do it for the sheer pleasure. If you're a high school student and you're interested, by all means, call around and see if you could shadow. And I believe, no, but they could actually be, they could be allowed to work, I think, and I've had young people, doing a little bit of the lab work. So there's a lot of opportunities. They could go also the volunteer clinics, the Miriam Clinic, Haifa Clinic that I have now. I did not put that in there. The Salvation Army, the Wake Smiles, so many opportunities, so many opportunities. There's now teledentistry as well. And we did that over COVID. We were able to believe it or not, we were able to speak to the patient. They were able to show us what was bothering them. We were able to call in medicine, but you just can't do hands-on. So for the high schooler, absolutely, there is so much you can do. Um, just reach out to any dentist. There's so many dentists in the state. Somebody should help. If not, they can call me. I don't care. I've been mentoring kids for as long as I can remember. So.
All right. Thank you so much. I think we're out of time, but we really did appreciate hearing from you today.
Yes,
Thank you for having me. I hope you enjoyed it. Thank you.
Yes, we did. Thank you so
you.
much. And
You're welcome.
Stay
You take care.
healthy. Yeah, take care.
Okay.
Bye.